I'd mentioned, it's okay to have girls up to 14-year-old to come and play. As soon as they're 15, 16, they stop playing. They prefer doing the indoor games. They don't want to come outside and play. So how do you sustain the participation of older girls? Breaking the silence. How do you talk about issues of sexuality and rights in communities? And lastly, which I think everybody over here is facing, how do you change the mindset of people that we work with, that sports, sexuality, rights, gender are issues that everybody needs to talk about. And at the end of the day, it's my body and I should be able to decide what I want to do with it. Thank you.
Thank you very much, Sanjana, for this very wonderful presentation and thought-provoking. Like how these sensitive issues like gender, sexuality, and the sexual rights, reproductive rights can be addressed through sports. And I think most of us, those who are sitting here, and I personally, I have worked very closely in the tribal areas of Jharkhand, Bihar, Chhattisgarh, in India. So I know the sports was the part of the culture of the tribal community. But it's only because of the degeneration of the value system. Now the issues are coming up, and how sports can play a very, very important role to bring them together, and will be in a position to address such issues. So it's a very wonderful presentation, Sanjana. Thank you very much. And now we are having the last but not least, very important presentation. Again, the public health issues, sanitation. And now we are having a very eminent speaker here, Thomston Kiefer, who is the founder and chief executive officer at WAS United. He is also, you'll be happy to know, he is also a Ashoka Fellow. He did LLM in International Public Law, University of Amsterdam, and he also did his PhD program, University of Potsdam. And I was really happy to know when I heard that a human rights professional, how he turned to the toilet construction, toilet activities, and also turned to an entrepreneur. So it's a very wonderful journey, and sanitation in India and throughout the world is a major issue. When we are talking about the hand washing, the toilet, use of toilet, when we are the personal hygiene. So lots of issues are there in the community, and how sports can play an important role, how the community engagement can play an important role. So welcome, Mr. Thong, and request for your presentation.
Thank you for the kind words of introduction, and hello everybody. Pleasure to be here. Thanks to the coffee that my colleague just got me, I'm awake again. I was a little bit tired in the beginning because I didn't sleep on the plane and only arrived 2 hours ago. But now I'm fit and energized again, and I hope you are too, and you're ready after talking about another taboo issue, sexual rights. You're ready to talk shit and toilets with me now for the next 10 minutes? Wonderful. WASH United stands for water, sanitation, and hygiene. United, 3 issues that need to be tackled together. United also because we approach water, sanitation, hygiene through sports. Why do we work on issues as sanitation and hygiene? I'm often asked. I mean, sanitation and hygiene is such a taboo issue still in many places around the world, and such a neglected issue in development cooperation, that I always still feel compelled to kind of like give people the basic background data. If you look at the world today, it's very hard to imagine that 4 out of 10 people on the planet do not have access to a clean and hygienic toilet. Hand washing with soap, which should be something that we do like toothbrushing, is not widely or consistently practiced at all. The results are super severe. Globally, diarrhea is the second biggest killer of children under 5 years of age. And in sub-Saharan Africa, diarrhea kills more children than malaria, measles, and HIV/AIDS combined. In India, the country we're here, India has actually more mobile phones than toilets. That's something that is often quoted, but that's not the only problem. It's not just about like having toilets or not having toilets physically. It's about using toilets. It's about changing your behavior in terms of like toilet use and personal hygiene. And what in development cooperation has been done in the last 20, 30 years, the idea was always like, okay, let's approach the issue on the supply side. Let us put toilets there, and they're going to be there, and people are going to use them. If you look at like rural India, northern Karnataka, for instance, a hotspot, you will find thousands of toilets that are used as chicken sheds, bicycle stalls, or even temples. Because the people never ask for that kind of sanitation. It's completely like not what they wanted, what they needed, what they aspire to, or what kind of like their mind was ready to absorb. So sanitation is a much, much more complex thing than just building toilets or just giving people soap. It's a very intimate thing. It's close to like a lot of like cultural, sexual taboos. It's extremely personal and it's extremely related to changing people's mindsets and changing people's behavior. In addition to providing infrastructure, people need to practice good sanitation and hygiene. It is also an extremely, extremely cross-cutting issue. Sanitation and hygiene is critical for education. If you don't have sanitation facilities in schools, girls start dropping out. If you don't have sex-separate sanitation facilities in schools, girls also start dropping out when they reach puberty because they can't manage their menstruation in safety and in privacy. Sanitation is critical for nutrition. There's a lot of research coming out of India now that directly relates stunting of Indian children to open defecation, to the practice of not using toilets. Sanitation is critical for gender equality because not having a toilet is not the same for a man and a woman. A man in India does it whenever he wants to. It's one big toilet. A woman has to wait till night comes and has to then the window of opportunity till the sun rises in the morning. But the cover of darkness is also the cover for the rapist, for the person who will molest her. So not having toilets is not gender neutral at all. HIV/AIDS, people with HIV/AIDS have completely different hygiene and sanitation needs and also water needs than people not living with HIV/AIDS. Violence against women, just something I mentioned. So sanitation and hygiene are issues that are relevant for most of the work that everybody here in the room does in all fields of sport for development. WASH United has, in order to tackle this crisis, come up with an approach that is new in the WASH sector. We looked at the issue, and maybe I start with a bit more here. You just mentioned that I'm a human rights lawyer, which is really true. I used to work on the rights to water and sanitation for an NGO based in Geneva, and I'm also a really, really big football fan. So when 2010 came up, the World Cup in South Africa, and it was 2009, and I saw all these initiatives mushrooming up there on education and malaria and polio, and another one on education and another on malaria, I was sitting there wondering, come on, where is now the people that help us kind of like to break the sanitation and hygiene taboos? Because right then, like the numbers were coming out about like diarrhea being, back then it was the biggest killer of children in Africa. And I was waiting for like a big push from the UN or anybody coming up there to take advantage of that. And nothing was happening because it was still like too much of a taboo for bigger organizations or even like a sport federation to embark on as a social cause. It's just, it was too dangerous, it's too dirty. It's a very dirty issue to start with. So my idea back then was, that's the opportunity. If we can kind of like get football superstars to become champions for toilets, that is really going to make people think about it and look at sanitation hygiene differently. So back then we started thinking about, okay, let us try that. And what are kind of like the design principles, the approach that we want to have to really change people's perceptions about sanitation hygiene, to really turn it around from something that is dirty, dusty, disgusting, cheap, to something that might actually be, aspirational, attractive, cool, that buys into people's higher level needs. And that is spiced up with some celebrity endorsements, some superstar role models that actually help us kind of like be champions towards children and be the role models that they aspire to. Didier Drogba has supported us for our campaign in 2010. And that is spiced up with some celebrity endorsements, some superstar role models that actually help us kind of like be champions towards children and be the role models that they aspire to. Didier Drogba has supported us for our campaign in 2010. Bayern Munich has supported us. On cricket, we've worked with people like Suresh Raina and the Pathan brothers. And yes, you don't get these guys to go to a school every week, but just having their image just turns things around. It is so emotional for children to see that some of these big guys actually care for them in terms of an issue that is as unpopular and as dirty as sanitation and hygiene. And the focus of Wash United in using these design principles is really not on, we don't build toilets. Our focus is on changing people's mindsets around sanitation and hygiene and facilitating behavior change. We have two levels of, basically like two main work streams that we work on. One is high-level public awareness campaigns, where we go into partnerships with federations, with other NGOs to really do like big campaigns that reach people at scale. We've had partnerships with federations, regional federations in Africa, and something that is very soon to be announced, we're going to be a charity partner of ICC for the upcoming Cricket World Cup, which is actually something which is really amazing, because they are going to be the first federation ever that dares to take sanitation and hygiene as a cause for a tournament at that level. And we're also the charity partner for the Women's World Cup, and there the social issue is going to be menstrual hygiene management, which is unheard of. I mean, they really kind of like dare to take these issues on. And so that is kind of like the campaigning work that we do. And at the heart of what we do is WASH trainings in schools and youth sport teams that are always implemented through local partners. So we, together with local partners, develop curricula that then are implemented through local partners in the countries where we work, in Africa or in South Asia. So in order to focus a little bit and to kind of like, I try to think like what could be most interesting for grassroots organizations present in the room. I really want to focus on how we use games and how we use games related to cricket and football to actually tackle concrete sanitation and hygiene issues, just to kind of like to give you an idea what is out there and think about like whether some of the work that we do or the tools that we create could be relevant for your work. Because the very important thing about our mission is that we do not ambition to start 20 country offices and have 200 people at some point of time. We see ourselves more as a creative agency, as a creative resource for the sector. An organization that develops content, tests it, brings it to market, and then shares it with anybody who wants it. Like grassroots sport for development organizations, like UN organizations, anybody who's interested in cutting-edge sport-based communication and behavior change interventions on sanitation and hygiene. So since we're in India, I took pictures from my India interventions. Everything is always based and starts with a training of teachers. When we go into schools, you need to train the teachers. You need to make sure that the teachers actually understand the programs, that the teachers are capable of continuing what you train the children, because repetition is key. You have to be sure that the teachers are on board and they actually are willing and capable of repeating trainings. Then we were talking this a couple of game examples. This is a game that is called the World Toilet Cup Cricket. This is an adaptation of a football game that we developed for Africa first. If you look at the ball, it's a brown ball and there's a fly on it. This is a shit ball. The goal is a toilet. The motto of the game is get the poo in the loo. You have 6 shots, everyone needs to score. Like on, like if you go to the toilet, you score the hole. You don't want to shit next to the toilet, you want to go in the toilet. So this is about never openly defecate. Every shit you make has to go into the toilet. Sounds very simple, but playing that game, visualizing, giving children the chance to experience that is completely different to somebody standing there and telling children that you have to use a toilet. And that is fundamental cognitive psychology. People learn very differently in a classroom setting where they're taught by a teacher, or when people together play a game where we have fun and where we generate insights for ourselves. If that happens, you generate your own insights with your friends in a fun environment. Those insights are hardwired to your brain. You're never ever going to forget that again. That is with you because you found out. And that is the basis of all these games. All these games are, not telling the children this is how the game works and this is what the game is going to say. No, play the game, find out what it's going to say. So this is the World Toilet Cup. This is a game called Bowl Out Diarrhea, where we have the diarrhea demon whose wicket you need to take using a soap ball. This is a game, like one of my favorite ones, classical Indian adaptation, Clean Hands Carom, where you have the carom board and you have the pieces that are germs in 2 colors, and you have the soap bubble striker. So the goal is to get the hands clean, get all the carom pieces into the pockets first. This is how you win the game. Traditional game germ pyramid, where you kill the germs using soap balls. Hand washing challenge is a game where children color their hands using turmeric powder, and then they wash hands against each other. 20 seconds, 20 seconds. One child gets soap, the other child doesn't get soap. You can have a small child compete with a big child, and the child without soap will never ever win. And that is also like a very strong lesson, because like hand washing, I can go there and just use water, and it looks clean kind of, right? If you put turmeric on it and you try it, you will see it's not clean. The shit does not get off. So it's because one of the things, visualize germs. Where are those germs that need to be killed? You need to find ways like to visualize things. One of my favorite games is called Tippy Tap Construction. A Tippy Tap is a hand washing facility that can be made out of basically a string, a candle, a couple of sticks, an old cherry can, and things that cost a couple of rupees. If you construct them in the right way, you can have a hand washing facility that lasts, where actually people do not have to touch the cherry can or anything where they could infect themselves with germs. It's so simple that children actually can build them themselves for their schools. And it's a great competition. You can have different groups of children build tippy taps. The best one stays. It's a hand sanitization solution for $1 a piece. It's great. It's a great innovation. Then complementary to the games, we have educational materials. The different steps of hand washing, educational posters telling children the right and wrong of here, the right one here would be about washing hands with soap and not just without, because on the left side, the germs survive. We have a Wash United pledge, which is a commitment to always washing hands with soap before eating and after using the toilet, always using the toilet and telling 3 friends and family about the good behavior. And after the training, one does the Wash United pledge, commits to good behavior, and gets a membership certificate in the team. So those are complementary things that kind of are around the training, where the child that learns, wow, there is the head of the team, Suresh Raina, I am in his hygiene team now, where you add another emotional layer to the whole training. So since 2010, when we started working, we have trained with our partners in Africa and India more than 100,000 children using different versions of the curriculum. In more than 400 schools and youth sport clubs, we have trained more than 1,000 teachers and coaches, and have through all these trainings again and again further refined the curriculum. So at this moment, we have different versions of it. We have in the process of refining a curriculum for India, where we're also in conversation with Magic Bus about adapting that. Different other partners, we have a curriculum for Africa, and at the moment we're also working on an MHM curriculum that is specifically for women and girls and menstrual hygiene management. For us, as I said, it's very important to look at what are the needs of all the partner organizations out there, potential partner organizations out there that want to work on WASH, that at the moment maybe just don't tackle the issue because they don't have the right tools, or they lack a little bit of the knowledge, or there's just nothing out there that could get you started on integrating WASH programming into their current work. So for WASH United, we are really committed to help building bridges between those sectors, linking the WASH sector, which is on the one hand all these organizations that work on water, sanitation, hygiene, and the sport for development sector, where at the moment we did not see that much link. We want to really enable and help sport for development organizations in the future to include WASH trainings into their work. And to facilitate that, WASH United has also joined the Street Football World Network last year as an affiliate member with specifically that mandate to help bring WASH programming into the Street Football World Network. To facilitate that, we are now in the process of organizing a first concrete intervention, which we call the WASH World Cup. The WASH World Cup is a series of tournaments and school training interventions across Eastern Africa in cooperation with 9 local organizations. 7 of them are sport for development organizations, including the Kids League in Uganda, Esperance in Kigali, MISA, who are here today, Carolina for Kibera, all Street Football World partners, which specifically are targeted to, as part of the program, to develop, refine, and test replicable football-based curricula specifically targeted to the needs of grassroots organizations in Eastern Africa. we want to create these tools that then we can share with the sector and with other partners in other countries. So the conference is called Next Steps. So I was wondering kind of like what could be the next steps for organizations then here if you're interested in working on sanitation and hygiene. We don't have those replicable things ready yet. This is work in process. But I would be super keen on getting in touch with everyone here in the room who's interested in exploring working on sanitation and hygiene in the future. So we have your contact details. I would encourage you to stay informed, subscribe to our newsletter and learn what is happening, what new tools are available, what products we can offer to your organizations in the future. And then later on get involved and really start taking action, because the sport for development sector has a lot of potential to help tackle this one of the biggest development issues that the world is facing today. And I think we need a lot more grassroots engagement on that. We cannot leave it like to the top-down mechanisms of the governments and the big agencies. And I just encourage everybody here in the room, look at your programming, look at your work, explore where are kind of like the overlaps, where is your work relevant for sanitation and hygiene, and try to address that more proactively and in the future, hopefully, with our support. Thank you very much. For the end of my presentation, I have a really ridiculous picture of myself representing the toilet at the United Nations.
Thank you very much. This was a really wonderful presentation and sharing the successful intervention and also like successful interventions for the collective actions, especially the wash and sanitation issues. Like it's always a big issues for all of us. Like prior to this magic bus, I was part of the DFID program. And DFID is, like a state called Bihar. All of you are aware. And there are 70% people are going for open defecation there. Yeah. So only the 30%, the toilets are there, but the using of toilets is a big, big issue. Yeah. So, I personally feel like we know the importance of sports, but so far as the sports is concerned, mostly we talk about the sports can teach us the honesty, the talk about the teamwork, adherence of tools, a kind of fairness. But I personally, based on my experience with many organizations and also like working with the state government, central government, like largely, it's underestimated as a kind of tool for taking this development agenda forward. But these are the examples, the best practices, especially in the public health, education issues. Like, yes, this can be a wonderful tool to take the agenda forward. So I appreciate and thanks to all of you, all the panelists, for your wonderful discussion, wonderful sharing of the best practices, the interventions, which can really bring a big change in the behavior of millions of people. So thank you very much once again. And before closing this session, we are having question answer session. So I request all of you that please free to ask questions from our speakers if you are having, and any comments, any suggestion if you are thinking which can be made here. Thank you very much.
My name is Parul Chet and I am from Gujarat. We are working with the children and youth in the slums of the city. I don't know how close and relevant this question to the panel, but I came here with an intention about, the sports are really a very powerful tool to bring the children and youth together. That we've experienced, but inevitably sports also brings the competitions, and which is good in a way when it is healthy competition, but it also creates times exclusion, and it also creates frustration for the ones who lose. So can we also talk about some other alternative methods where we have something more which is more inclusive, where there is no competitions. Like for example, we are part of this global network called Play for Peace, and where there are lots of games. There are some sports, but more games, and these games are very inclusive. There's no winner, there are no losers, and no one is out. Everyone is always in. So, can we also promote something like that? It would be very nice if some of you have done anything like that. It would be nice to hear from the panelist or anyone else. Thank you.
Yeah, I would like to share like what we do in our schools. We especially encourage, usually in any group or any class or any organization, you have, fast learners, slow learners, and medium learners. And we do not call them as slow or fast, we could call them as concept learners, because we have to make a child learn the concept of any topic of any lesson. What we do is we make the concept learners get involved in sports or anything or whatever but not as a competition. If they win, it's okay. But if they do not win the competition, we always encourage them, because by encouraging them, instead of being always been told by the students that you're not getting good grades, you're not getting this, you're not getting that, but you're empowering the child to play and to prove themselves. Apart from education, they have different fields to prove themselves. So that way, we can divert the energy of a child from one area where they're weak into an area where they can participate and be empowered, So this happens all the time in our schools through educate, engage, and empower, Hope I answered your question.
Hi, I'm Rashmi. I'm representing Chintan here. We are an environmental research and action group. And particularly to Thorsten, we work with a target group which is waste pickers. And where there are waste pickers, the issues of water, sanitation, hygiene, all of them become very, very important for us. And therefore, just a comment that I'm very excited about what you're doing, and maybe hoping to learn a lot from what happens later on. And learning from Kriya again was we're only doing programs wherein we are implementing it with waste pickers, starting from a spectrum of children to adults. But and listening about sports all these 2-3 days, I was wondering how to integrate, and this clearly showed us how to integrate it in our programs and what are the new ways of doing it. Thank you so much.
Hello everybody, I'm Anders from Football for All in Vietnam. I hear your question. I think that has very high relevance. And I think this is also down to an understanding and definition of what is grassroots sports. We heard in the plenary session a very narrow interpretation of grassroots. Grassroots is there to create a pathway for those who go into professional sports on one level or the other. My definition of grassroots sport is totally different. That is anybody not receiving any money to do sports. That is grassroots. That's for me. I'm overweight, I'm too old, I cannot reach that level, I can still do sports. And I think this is a huge challenge. Because, for example, here in India, we have not even been able to provide the most basic grassroots activities for the few that can make a career. How can we then accommodate all those who want to play? The approach in Vietnam has been we do it through the schools. We start as clubs there. As for gender participation, we actually do demand 50%. We said that, and there were no girls football when we started there. And we just said that all the boys want to play, bring a girl. Otherwise there will be no football. And they did, and 7 years later, that's not a question anymore. The girls play football just like the boys. But they come to the club knowing that there's a place for anybody, regardless of your skill, regardless of your ambition, or your parents' ambition, or your coach's ambition, or your teacher's ambition. It's there to have fun. Which means that we pay a lot of attention on the age group from 5 to 12, non-competitive. We don't have playoffs and finals for those age groups. We ensure equal playing time. We're playing five-a-side football. We have 2 halves. 5 of the players play the first half, the other 5 play the second half. We ensure that everybody gets to play. Small little things like that and a wider understanding of what is grassroots, then it's easy to see that the purpose of the grassroots It's not only health related, it's not only to motivate for education, but it's also very easy to include the different life skill components, like youth and sexuality, like sanitation and hygiene. We work on a number of different things. We work in inclusion to this. We work with HIV/AIDS. We work with communication skills. We work with high-risk education for unexploded remnants of war, traffic safety, and so on and so on. And it's for all. And you know, when we talk about all, be clear on your definition. Boys, girls, disabled, minorities, any form, gay, lesbians, dare to say it from day one. No, regardless of political background or views or religious views, doesn't matter. If there's any obstacles in the way, like for example, where the Muslim girls couldn't play because they weren't allowed to with the headscarf, remove the rule, change the rule, and keep it open. And then you have true grassroots, and then you will see the purpose of having grassroots changing totally from only a talent developing perspective into social change. Thank you.
Hi, good afternoon. My name is Uma. I work with the Sir Ratan Tata Trust, which is a philanthropic division of the Tata Group. And it was really interesting to see how sports, the method of sports has been used in different sectors, such as nutrition, education, water and sanitation. I specifically have a question for Sanjana. Sanjana, in your presentation, you had mentioned about how the boys used to kind of prick the ball of the girls. How did you overcome the challenge? Because that is also something that we will be looking at perhaps in the next 1 year, wherein we're going to be working with rural communities in North Karnataka. So if you could just elaborate a bit more as to how you overcame that challenge, because gender inequality is prevalent in North Karnataka. So this one's for you. Thank you.
Yeah. Thanks, Uma. I think that's a challenge you can never overcome, because the point is through this program or through this particular methodology, you're constantly challenging the space, the power and the norm, privilege that boys and men have always had over sports, over public spaces in communities, and over a lot of other things. So I think what we try to do is, at Kriya, usually we do not work directly with men and boys because of our belief that whatever resources we get, we want to prioritize that for women and girls. But now, learning from our last year's experience, what we're trying to do is we're trying to engage with the boys and the men in the community as much as we can from day one. So what we're also trying to do is we're bringing them to see a lot of the training sessions that happen with the girls, where they're able to interact with them. In fact, a lot of boys in the community have told us that, you know, even we don't get to play football so much, and even we don't get to attend these sessions, so you should do something for us as well. But due to constraints on resources, what we're trying to do in our community engagement pieces, reach out a lot to the families, to the boys, and basically also not build a divide of boys versus girls, but also try and include them in the game. So for example, when we organize public events where we have a lot of events. We have football, we have cycle races, we have athletics, and you know, we encourage the boys to participate in that with the girls. So we try and do mixed matches. We try and, a lot of the male teachers in schools have offered to help us with the, you know, in explaining the rules of the game or being the referee or the umpire. So I think there is no one fixed solution as to how you overcome it. And but I think you have to constantly keep introducing strategies and initiatives which will involve the entire community and not really like build a wall between them. It is difficult, and like I said, you can never totally overcome it because it is difficult, but I mean, you have to keep doing things. And I just want to go back to what Parul, you had asked, and reinstate what you had also said, that in our program also, the focus has always been to say that what happens before and after the game is more important along with the game as well. So the spirit of competition, the idea is not to introduce games which are threatening to some. So if there's somebody who's disabled, or there are lots of girls who don't like playing sports, and which is I'm sure which is very normal. There are a lot of I'm sure there are people in the room who've never played sports because you don't enjoy it. But that session and what happens before, the program has to provide that space for everyone. where they can come and learn. And it's not just, and from our experience till now, we haven't really pushed in making teams and participating in competitions precisely for this reason, because we feel that we don't want to always push for winning medals or competition, or I'm in the team and you're not. So I think making programs inclusive for everybody is most important, especially in the context that we work in, because there are lots of barriers in terms of caste and class. We always see the the Brahminical caste participating more in the programs. The Muslim girls don't come so much. The Dalit girls do not attend. So we have to always try and think of different strategies in terms of where you choose to hold the session. What days you choose to hold the session, which school do you collaborate with, which community park you're using. So I think in the design of the program, if we try and keep it inclusive, it can address the competition streak.
You spoke about how sport organizations can ignite a movement by adopting the franchisee model and developing the interventions into institutions or clubs. So in that sort of sense, what are the best practices in terms of affiliation? So do you affiliate yourself to already existing public structures, or do you start out as a private club or a private enterprise and develop it? And how do you develop that identity along the way?
Yeah, thanks for your question. So we're basically about trying to fast track that learning and not reinvent the wheel. So in that sense, we don't want to create new structures, and we want to reuse the infrastructure that's already in place in the different countries. So I think you might be familiar with the Street World Football sort of model of partnering. We will be certainly reaching out through partner networks in the countries. The partners you can see at the top of along this banner here are the core partners that have sort of agreed this globally to ignite this movement. As we work in each different country, the context of nutrition is different, and the resources that might be available to respond to nutrition are going to be different. So we're trying to create that flexibility to say, who are the best partners locally for us to do this, and then work through those already established networks.
The lunch is already there, and we are running short of time. I think it will be good if we can have a kind of one-to-one discussion during lunch. So this is my suggestion, and thank you very much to all the speakers for your valuable presentation, and thank you all my friends for your active participation and wonderful questions also for clarification. Thank you very much to all of you. Thank you.